You're an expert in prostate cancer, still a big problem for men. Why is that? Do we have a good idea of the causes?
Prostate cancer, like any other cancer, it's very difficult to pinpoint a cause. Now, I theorize, like many other cancers, that prostate cancer is an environmentally induced disease. I am actually finishing up my book on the topic, so I'm very much versed in it now from a scientific and literature perspective. I also believe that just because you have a genetic pattern to prostate cancer does not make you more prone necessarily to prostate cancer. There's a whole area of science called epigenetics that shows that your environment either causes these cancer genes to express themselves or not to express themselves. So I certainly believe, and I've at this point pretty much conclusively, that the environmental aspects have a greater contribution to the formation and development of prostate cancer.
What sort of things are we talking about?
Well, what happens with men as they get older? You're rarely going to find a 22-year-old male with prostate cancer. Oftentimes it's an aging disease, like many other diseases. What happens with men as they age is a variety of things. They become more stressed, so right around their 30s, what happens, right? More responsibilities, more children, bills, etc., and work stress. So that, I think, is a major factor. Then what comes along with that is less physical activity, less movement. You get bigger and so forth. You increase your body composition changes. There's more body fat in there. Well, what happens when there's more body fat? You're more estrogenic when there's more body fat. So there's a lot of receptors in around the prostate that are for estrogen. Well, we're not supposed to be too estrogenic. What I can tell you is that we used to believe that testosterone caused prostate cancer. That's not the case. Again, 22-year-olds that have flaring testosterone levels don't get prostate cancer. I think at this point in time that at least one of the hormonal aspects that contributes to the risk is actually estrogen as one gets older. I think that's an important factor. Of course, things that you eat and don't eat, physical activity, staying lean and mean is actually prevents you or lowers the risk of prostate cancer. And taking good, solid nutrients, minerals, magnesium, selenium. Selenium is if you take it in a supplement, it should not be selenomethionine, because the literature clearly indicates that actually increases the risk. You want to take something like high selenized yeast from Seleno XL, for example. And I think controlling blood sugars is very important. That could be a very lengthy conversation, but we'll leave it there for now.